All right, good afternoon, everyone. I'm Chad Sleeper, and I'm the Program Director for the Global Health Law and Policy Project. Very glad to see you here today on this rainy Monday. I appreciate you coming out and supporting your colleague, Dan Hougendobler, and the Global Health Law and Policy Project. Dan did some fascinating work this summer in Rwanda around the President's Emergency Plan for AIDS Relief and how it was applied there. We're very anxious to hear about his experiences. I wanted to tell you just a few things that are coming up with the Global Health Law and Policy Project this semester and next. On November 16th, our final Fall Forum Series event will be taking place. Courtney O'Donnell with us here today, and Janine Pravat, who is in Australia but will hopefully be joining us via Skype or something like that, will be telling us about their experiences in Liberia this past summer as part of the GHLPP Summer Scholar Awards program. Coming up next spring, the Global Public Health Law course is being taught again by Polly Price this year, and we're building in something very innovative into that course that I hope some of you will be interested in and hopefully will register for, and that's a service learning component. You'll be able to register for the service learning component and get an extra hour of credit for that course, and you'll go out into community organizations that are working with migrant populations with access to health and with some other issues. It'll give you a really good experience to see what challenges they face with healthcare. And so we'll tie that back into the course as well, but we hope that some of you will be interested in that. And finally, our Summer Scholar Awards program will take place again next spring, a competition for you to receive funding to go do things like Dan did, like our other summer scholars did this past summer. So these sessions are really important for you if you're interested in that, to learn about how they planned a project, what they actually did, and how they were successful in securing funding through this competitive process. So since we have such a small group here today and we've only got one presenter, I'd like for us to go around and just introduce ourselves. Since we're recording, I'll just pass this mic around. If you can just tell us your name, your class year. I'm assuming you're all in the School of Law. If you're not, let us know. And just introduce one another and we'll get to know each other.
I'm Shannon Kyle. I'm a second year in the law school and just fascinated by the idea of doing work overseas. Dan's experience, Courtney's, Janine's. Exciting.
I'm Jeremy Roth, also a second year at the law school, and also just have a general interest in public health.
I'm Lawrence Live. I'm a first year here at the law school, and I also have an interest in public health.
I'm Ann Johnson. I'm a second year at the law school, have an interest in public health, and I'm very interested to hear what Dan has to say today.
Hi, I'm Courtney O'Donnell. I'm a 3L, and I've just been interested in international human rights stuff and international work generally for a long time, and I'm interested to hear what Dan has to say as well.
I'm Erin Donahue. I'm a 2L, and I'm interested in all things international. So.
I'm Dan Englander. I'm a 1L. I spent a summer in Kenya doing HIV education and a summer in Malawi studying funding streams, and so I'm interested in global health law.
And as a 1L too, I would say pay particular attention to Dan, who's our only 1L to receive funding last year for a summer project. So it can be done as a 1L to apply for a Summer Scholar Award. So Dan will present for a little while here, and then we'll open it up for questions and answers. So please welcome your colleague, Dan.
Thank you. Okay. So I just have a really short presentation. I kind of feel like the uncle who gives the slideshow of his vacation photos, and nobody really wants to watch it. So I'm going to try to make it quick. Let's see. So what I'm going to talk about is. So just to give an overview of the projects that I worked for and the work that I did, and then very briefly talk about how I designed my project and the summary of my results. So there's a lot of detail, and if you guys are interested in that, you can ask me questions, but I'm not going to go into it on the PowerPoint because it's too boring. And then I have just like 3 suggestions for if you guys wanted to do a summer project. And then at the very end, I promised some friends in Rwanda that every time I talked about Rwanda, I would plug it because they want more tourists. They want people to come and see their country, and it's really beautiful. So I'll just show you a few photos and talk about my experiences there. So this is just a map of Rwanda. It's on the east side of Africa. You can see Tanzania is there, Uganda is on the north, and it's an old map, obviously, but that's the Democratic Republic of Congo, which used to be called Zaire. And then it's bordered by Lake Kivu, which is really beautiful, actually. And I worked in Kigali, which is the capital. Rwanda has a population of about 10.5 million people, and in Kigali it's about 900,000. It's the most densely populated country in Africa, and it's kind of surprising because it's really mountainous, a lot of hills and that sort of thing, but they really make use of the space well. It's a pretty low HIV prevalence rate, 2.8%. A lot of that is due to the fact that the government responded quickly and it responded well to the issue of HIV, unlike other Southern African countries sometimes, especially like South Africa. Part of the reason they have such a high rate is because they didn't respond appropriately to it. So as probably one thing that everybody knows about Rwanda is about the genocide. You know, you've seen like Hotel Rwanda and that sort of thing. So the conservative estimates are between 800,000 and 1 million people were killed. Mostly Tutsis or moderate Hutus. And this is a picture of the genocide memorial. These are all skulls of victims. And they put these skulls in to remind people that the genocide happened and to make sure that nobody could ever deny that the genocide happened like they do for the Jewish Holocaust or that sort of thing. So, but then, since this is so depressing, I decided to put some like cheerful photos into. This is a school that we went to. The Rwandans really value children more than any other place I've been. They always talk about how they're the future of the society, and everyone takes responsibility for all the children. So there's a couple other little children. I had to resist the temptation to put like all cute kid photos in here. They're great, but. So my work was on PEPFAR, which is the President's Emergency Plan for AIDS Relief. And there is a ton of money that has gone into it. It started in 2004, and the U.S., along with the global community, kind of realized that we have really neglected this whole AIDS problem, and so they decided to pour a bunch of money in to ARVs, prevention, different things. So it started with 15 target countries. I think all but one were sub-Saharan Africa. And it was reauthorized in 2008, and they gave another $39 billion. And then the 3 ones are just like their kind of operating principle they use to consolidate all the funding and the coordination. So this is the only graph I'm going to, I promise, this is not going to be one of those boring presentations, hopefully. So this is the funding trend in Rwanda. And you can see that like because of the budget crisis in the U.S., most of the PEPFAR funding is kind of flatlined, which is going to cause some big problems because a lot of people are already on ARVs. They have to maintain them. Then they have to put new people on. So this is kind of, if somebody wants to do a project on PEPFAR, this might be a really interesting thing to talk about, would be how can countries deal with this flatlining PEPFAR budget when it's been increasing so substantially over the last few years. This just kind of was an interesting picture that I took. It's it kind of, to me, it symbolizes like where Rwanda is right now. It's the development is going so quickly and everything's but there are just these gaps where they haven't gotten to this problem yet. And here, we're just driving down this road, and all of a sudden the road just ended. There's just it just started, like grass starts growing, and it's not even like a gravel path or anything. It's just so I don't know. I just thought it was an interesting kind of representation of Rwanda. But let's see, okay. So this is where I worked in Kigali. It's called Project San Francisco, and it's run by Dr. Susan Allen at the Public Health School. See, and that's just kind of the front gate. I lived actually right next door. We actually lived on the grounds of the project. So, let's see again. So they have 2 sites. Their first site is the one that I worked at and lived at, and it's couples voluntary testing is what they concentrate mainly on. So their idea is that you want to get couples together to get tested together, counseled together, and then if they need treatment, then they, especially for discordant couples, they can treat the the one who's HIV positive and help to make sure that the one who's HIV negative doesn't get infected. And you guys probably know this, but like the majority of transmission occurs through heterosexual, and a lot of it occurs through long-term relationship type sexual relations. So this is a huge issue, and it's a really interesting approach to it, I think. Now, I didn't really work directly with their project, with what they did, but at the beginning of the project, you had a 2-week rotation, so you got to see everything that they did, and then I got to kind of work with them on my off time. I got to go over there and help out, and it was really cool. And then there is a second site, which is also amazing, and they have some of the coolest scientific equipment I've ever seen, which I was amazed. I was in Rwanda, and I saw they have a machine that, I mean, I don't know if this is that amazing, but it was to me, that takes the liquid nitrogen, or the nitrogen out of the air and makes it into liquid nitrogen, and they had machines that could count all the white blood cells, and it was just very high tech, and they're trying to work to get an AIDS vaccine. So they do two things. They test blood for of people who are especially resistant to HIV and that sort of thing, and they send samples to the U.S. or to Europe to IAVI labs, and then they also enroll groups in vaccine trials. Which when I was there weren't any, but maybe with this encouraging result in Thailand, we'll have something to work with. Although apparently, since it's a different clade in Africa, it's going to be difficult to translate it. But okay, so this is where we lived, which is very nice. We had a great apartment. We each, I think, 3 of us lived in this apartment, and I will spare you all the boring details of my day-to-day life. But so my project was to look at the perceptions of PEPFAR. I didn't really look at the details of any data or anything like that when I was there. I just asked people, and I asked leaders of NGOs, government, clinic or hospital managers, what do you think of PEPFAR? How do you think it's worked in Rwanda? Has it helped? What could be improved? That sort of thing. And so my research design, it was a qualitative study. I didn't have any sort of data collection except just the interview. And the questions were supposed to be very open-ended and make it more of a conversation. And so basically what I was hoping to get is what works well in Rwanda and what doesn't work well, according to these leaders. And there are definitely significant limitations, obviously. I was there for a summer, for one thing. And it wasn't really representative of all Rwanda, because I could only travel where they would provide me transportation, which was maybe a 2-hour radius around. So I got to see some rural and I got to see some urban, but I didn't get to go and say to Musanze or something and do interviews there. So really, I'm sure that their needs were different than Kigali's needs. So it really is a very limited result they got. This one was probably the most significant. I found that people were very reluctant to criticize any government program. I'm sure, Shannon, you've noticed this too, that there's this deference to authority that we're not as used to, I guess, in the U.S. And so people might be dissatisfied with the program, but they wouldn't necessarily express it. They'd always say, "Oh, PEPFAR is wonderful. It's provided so much for us." And I would have to kind of probe to get them to talk about anything that might have been a problem. So, and I didn't have time to really develop a reputation or a rapport with them. So that was a difficult thing to overcome. And yeah, also, of course, the language barrier. Even though it's a Francophone country, and I don't really know French, but really what you need to know is Kinyarwanda to get around. And so, I could interview people who are the top people I could interview, but if I wanted to interview, say, nurses or something like that, you had to be able to speak Kinyarwanda to really. So I had to have a translator, and a lot is lost in translation. I know. So I'm just going to give you 2 slides of some of my results. So there was probably the number one comment was that the indicators of PEPFAR had emphasized quantity more than quality. So they might ask you, how many people did you treat, or how many training sessions did you hold? But they never asked how long were those training sessions, or how did you treat the people? How long did you keep them on ARVs? That was just all they wanted to know were the numbers. And the organization said that's not enough. We don't feel like our results are really being reflected in what we have to report to PEPFAR. And also, another really frequent one was that it's also related to this, that they measure short-term progress but not long-term progress. And so there's been, it's an emergency plan for AIDS relief, but a lot of Rwandans think, well, we have a 2.8% prevalence rate, the emergency's passed, now we can start working on more long-term. So this goes with the 3 ones that I had on my other slide, but they in Rwanda have, you wouldn't believe how many NGOs, how many government agencies, and there's infighting within the U.S., USAID, and the different sponsors are always kind of having turf wars and that sort of thing. And they said it really does detract from the amount of coordination that they see. There's also the very short funding cycles, which goes along with the short-term versus long-term. They think that they should have, they have yearly funding cycles almost always in PEPFAR. And a lot of the partners think that it'd be better to have a 5-year cycle, a 10-year cycle, so that you could plan a long-term intervention. And also, it's really hard on morale, because I talked to one person who said that she had to hire 20 people to meet a PEPFAR grant, and then a year later she lost the grant, so she had to fire all those people. And in a country, with high unemployment and where community is very important, that can really hurt your organization long term. And also, one thing I saw in Rwanda is that firing isn't taken as lightly as it is in the U.S. It's almost a personal attack. So I think that the U.S. needs to start realizing that you need longer funding cycles. Okay, I just have 3 more of these, I promise. I know they're boring. So the one problem was that they call it in PEPFAR lingo, they call it harmonization, which is kind of getting the country's cultural and government policy in harmonization with the U.S. PEPFAR policy. And they said that to some extent that's good, but they haven't. The U.S. hasn't quite done that with PEPFAR. And one issue that's stretches across all PEPFAR countries is the emphasis on abstinence and monogamy and partner reduction, which, it works in some cases, but a lot of times you need something else to go along with it. There are also a lot of reports of people bending the rules, and I was impressed that people were willing to talk to me about this, but several of my interviews, they said that they would get a grant for one thing, and then but to actually make it effective, they would have to maybe work with prostitutes or something like that, which PEPFAR explicitly prohibits. So, and I misspelled redefining them. Okay. So this is the kind of the main, takeaway from my interviews, is that it should switch from a short-term emergency plan in Rwanda to a long-term development plan. And almost everybody they didn't all say that explicitly, but they all kind of led to that conclusion in a sense. So that's kind of what I said. So that's the main finding that I just said. There's just this general idea that PEPFAR is just too quick of a turnaround. You need to have a chance to plan. Oops, sorry. And then the one thing I wanted to emphasize too is that everybody had something good to say about PEPFAR as well, and it really has made a big impact when you pour that much money into a country. And a lot of thought did go into PEPFAR, and I think that people have really recognized that, and it really has raised perceptions of the U.S. in Rwanda. So, okay, so this is part 2, which is probably more important. So, the first step and that's just my, like, this is not endorsed by anybody. This is just how I went about it. So there are a million different ways to do this, I'm sure. But I thought about what I was most interested in, which was how U.S. policy impacts HIV/AIDS in sub-Saharan Africa. That was the thing I'd worked on before and that I was really interested in. So what I did is I wasn't sure exactly what I wanted to research. So I went to Professor van der Vijver, if that's how you say his name. I always get confused about that. Van der Vijver, thank you. And I asked him if he knew anybody, and he knew Dr. Allen. So I think networking is the key thing here, and talking to faculty members, and just be flexible, be willing to reassess what you're interested in. My project changed about 5 times before I finally settled on what I wanted to do. But I would say finding your topic and then finding your mentor, they have to happen at the same time. Some people I know probably have like a very specific topic, and that's great, and then you can just find a faculty member first. And then also look outside the law school. You have to have a law school mentor, but also some of the people who might have the most alignment with your interests might not be in the law school. And so I worked with Dr. Susan Allen, and she was great, and she really helped me to refine my research interests, and she really, like, my paper is going to be more law focused, but she really helped me to understand like the Rwandan culture and what to expect, and my original project it just wouldn't have worked in Rwanda, and she let me know that. So it's, you really need to know somebody who knows the area, somebody who can really give you specific guidance on that. And then funding is always the hardest part, I think, obviously. So I really don't know that much about the funding sources, but I know, the GHLPP grant was great. It was, it's a long process to apply and all that, and you have to really have a good idea first, and it has to be health policy related. So I know some of you might not be interested in that. There's also EPIC grants. I don't know the details. A lot of people here know more about that than I do, but I know that you have to work for a lawyer, or it has to be in a legal capacity. So I know my project would not have qualified for EPIC funding because it wasn't law focused enough. But and then there's tons of external sources of funding. They're really competitive, but I think we're all competitive people, and we can do it. So that's something to look at as well. Okay, and so this is the part that I promised my friends in Rwanda that I would try to get as many Americans to have a different perception. I think everybody in Rwanda, and this might be true, they feel like all Americans know about Rwanda is the genocide, and they really go back and tell people about Rwanda and let them know that there's a lot more here than pain and post-genocidal stuff. So this is a picture of Nyungwe National Forest, which is absolutely beautiful. Hiking through there. It's Rwanda, I think, has 4 national parks, and they're all amazing. This one's in the south, and it's a tropical rainforest. Okay, so this is a shop that was in Kigali. Every time, I shouldn't say every time. A lot of times when I met a Rwandan, the first thing they would ask me is about Obama. They were so excited about having an African as our president, and so that would be like the majority. It was a great opening topic, and there's just a really high perception of American culture and Americans. And but this was not the only Obama shop that I saw either. So this is Kigali. This is you can see how steep the hills were there. The nickname for Rwanda is a land of 1,000 hills, and it kind of definitely shows you Kigali is definitely built on hills, but they have this little kind of flat area in the middle where they play soccer and that sort of thing. This little kid we met, we were hiking Mount Kigali, which is right by the city, and you'd always have a trail of kids following you everywhere. And they knew like maybe 2 English phrases, and one of them was "How old are you?" But they would never understand your answer, so they just keep asking you over and over. They'd also ask if you spoke English, which they didn't speak English, but It's kind of funny. And this is another picture of Nyungwe. It's waterfalls, and there's a lot of wildlife too. I didn't put those pictures in, but there's chimpanzees, and it's a great place to visit on a budget. It's not very expensive, and you can stay in hostels. I probably stayed usually $5 a night for a pretty nice hostel. So just getting there is the expensive part. We got to hike up a mountain and see mountain gorillas, which was like probably the highlight of my entire trip. And this is the silverback of the group, and so that was probably the most amazing thing I did. So if you ever have an opportunity, most people go to Rwanda just for the mountain gorillas and they just go home, but there's a lot more to see there. So yeah, it's my presentation. Yes.
Can we hold off on questions for just 1 second, because we're going to pass the microphone around. I want to mention a couple of things, follow up on a couple of things Dan said about funding. One is that we have timed our application process in the past, and we anticipate doing so again this spring, to come before the EPIC grant process. So if you develop a project and you'd like to apply for GHLPP funding, and you're not successful in obtaining our funding, and you'd like to apply for an EPIC grant, that has typically been okay to do. Other thing I want to mention that Dan did a very nice job of last year, he may or may not realize that he did a really nice job of this, is taking that broad topic and then narrowing it down to something specific. When you mentioned that your interest was how U.S. policy impacted AIDS in sub-Saharan Africa, that actually sounds very specific to a lot of people. And it was really good of you to recognize that that's really a very broad topic. And you do have to, if you're going to be successful in getting a grant from us or from anyone else to do this type of work, you really have to drill down to what exactly it is you're going to study. So while you may have something that you feel is a pretty specific topic, it's really more of a specific interest sometimes. And so we can help you kind of drill down to what it is and put you in touch with the right people to help you drill down to what that truly specific topic is. And Dan did a really great job of that last year, which is a lot of why he was successful in obtaining one of our grants. So let's go ahead and open it up to questions.
This is sort of a two-part question.
Uh-oh.
But same idea, not one of those difficult ones. With the different PEPFAR countries, do they tend to be adjacent to each other? And do the Rwandans, I know from my experience in Tanzania, every time there's a violent crime, the Tanzanians say, that must be the Kenyans. Do the Rwandans sort of recognize with the 2.8% that the surrounding countries may be as much of a problem? Do they blame? What do you think about that?
So I think, okay, first of all, the PEPFAR countries, they don't tend to be directly adjacent necessarily. I mean, a lot of it is Southern Africa because that's the worst HIV problem right now. There's a lot of they tend to all be sub-Saharan African. So I mean, there aren't. I wish I knew I had a whole list, and it wasn't just the severity of the HIV problem that helped determine. It was also, how likely the country was to be able to distribute the resources well and that sort of thing. And Rwanda really isn't one of the worst countries in terms of the HIV epidemic. And that's part of the reason I chose it was because it's almost post-crisis in the HIV sense, and so it's interesting to see like where should PEPFAR move in those sorts of situations, like in South Africa, or like Botswana, or any of the Southern African countries. Really, it's still in a crisis, and I think people would still say that the funding needs to continue to be in an emergency fashion. But yeah, and then in terms of blaming others, I didn't really see that, actually. I think that the Rwandans right now are so concerned with fixing their own problems in their country. I think the genocide has really, they don't blame anybody for it except for the French, which maybe, and the Belgians, but they don't blame any other Africans for it. They don't see like an external other as causing most of their problems. They really feel like, and they're super optimistic about Rwanda too. I think they don't have a lot of motivation to blame people because they feel like they're doing so well that they want to take the credit for it themselves. So and they should, because they've done extraordinarily well since the genocide. And so yeah, I almost answered your question. Okay, yeah.
The shift that you talked about from going from sort of short-term to long-term vision, how do you think that would really manifest? Like specifically, what policies would you change, and how do you think that would affect the people who are still sort of in need of like that emergency kind of aspect of it? And for like the more long-term sort of part, do you think that would mean supporting other health indicators, like sort of spreading out to take a step back and sort of look at the reasons why people, get HIV/AIDS, things like that?
Right. Yeah, a lot of the people I talked to said we should start looking at the long-term indicators. Poverty is a huge one that, and look at long-term education. I think what would need to happen is PEPFAR would need to get longer budget cycles. Do 5 or 10 year grants, something like that, where an organization can get a PEPFAR grant and know we can do this. We can commit these resources for the long term, and I think also PEPFAR needs to be more, it's responsive to countries' needs individually, but whenever you have Congress involved, they want to put a lot of restrictions. They want to make sure that nothing they don't like happens. But the only way it's going to be effective is if each country can have a specific plan tailored without a lot of restrictions. And Rwanda could go more long-term. Countries like South Africa could still have a crisis kind of mentality. And I think that would be the best of both worlds for both countries.
Just to add, kind of build on what Dan just answered and what you asked, another thing about Dan's project that made it very good for our program and very fundable within our program is that he was always planning to kind of follow up on the work he did in Rwanda and bring that back to Atlanta when he got home and actually do something with it. So, asking the question that you did, Lauren, about, how would you change the policy? That was always a part of your plan, and that made the project very attractive to say, that not only do I want to go study this, but when I get home, I'm going to, and Dan's now enrolled in, I don't know what you're calling it exactly, independent directed readings with Professor Vertinsky, so that he can actually flesh out that paper and get it written. And we were all confident within the project that that's something that might even be publishable somewhere that could really have an impact on the policy in this area. So another thing to consider if you're thinking about the grant process. Other questions?
Dan, what kind of problems did you run into as an interviewer when you were trying to frame your question and really get through to people?
There were a lot of problems that I ran into. So I think the first one is that you had to strip your question of any colloquialisms or anything that would be difficult for them to understand because their grasp of English was so limited. And I think so. When I first drafted my questions, they were complex. They had a lot of comma clauses and things like that. I had to strip it down to the bare minimum, and it was actually a good exercise too in really figuring out what I wanted to ask. It really helped to focus the question, and so that was the first thing. And that I recognized early on that was going to be a problem. So, in framing the questions, also you have to be really sensitive. Rwanda, it's a great country and it's really well managed, but it's also a very restrictive country. There are a lot of things that you can't do and you can't say, and so you have to be careful. You can't make any questions that would suggest that you're criticizing anybody in the government and even U.S. government can be problematic because there's this cultural barrier to talking about authority negatively. So you have to if you're going to say anything critical, it has to be the program and very specifically, I saw that it helped to narrow it down to what do you think could be improved about this specific aspect rather than saying what could be improved about the U.S. government's policy or something like that. So,
were you able to record the conversations or did you just have to answer with
it's very interesting. This is something I should have probably mentioned in my presentation, but Rwandans are very suspect of recording devices. They don't like being recorded on audio. They don't like having their picture taken. That's why there's so many pictures of kids, because they were willing to have their picture taken, but adults don't like it. And a lot of that ties back to the genocide where sometimes the lists that were made, photographs were used, and they kind of prefer to stay under the radar. So it was definitely something where I ended up typing it on my computer while they were speaking because I just didn't want to have to deal with, I didn't want to make them feel uncomfortable right from the beginning,
Building on that question too, another thing to be aware of when you're working on a project proposal is you may or may not need IRB approval. Does everyone know what an IRB is? Institutional Review Board. These are the boards within universities and other organizations that do human subjects research that approve whether or not that research can be done, whether it's ethical and all those things. And so for most of our projects, they're not subject to IRB review because people are doing kind of program evaluations and it's not really research. It's not aiming to be generalizable knowledge or anything like that. With Dan's, it was. And so Dan was able to tack on to some projects that Professor Susan Allen had going on in Rwanda, and she was able to obtain IRB approval through some pre-existing projects that she had for Dan's work. So that's another reason to identify your mentors early on, because you may need help in that process. Courtney, you had a question, I think?
Yeah, I have a couple questions that are not related, so I'll ask them one at a time, I guess. Also, about the interviews, I mean, I definitely experienced the same thing where people, if anything, people were really afraid to say anything negative. And it was hard because people would say, okay, X is the biggest problem. Go interview these people and talk to them about it. And then I'd talk to those people that said it was a problem, and they'd be like, we have no problems.
Exactly.
So I don't have an answer. I was just curious if you have any ideas of how you would do things differently. I mean, I guess the obvious answer is just like spending more time and building relationships. But, I mean, is there anything else that you would change or you've come up with other than that?
Yeah, it's just really hard. I think, a large part of it is choosing who to interview. There was a certain, I don't know, the higher up people got, the more secure they got in answering my questions. Mm-hmm. And so I think, if you're the director of a program, you don't fear retaliation as much as you might, and you're more educated maybe, and you have more understanding that like nothing bad is going to happen if I say something negative about the U.S. There are some anecdotal reports that I don't know if this is true, but there's some anecdotal reports of PEPFAR kind of finding out about people being critical and taking revenge. But that in the bad old days under Bush. That wasn't supposed to be a general statement. Sorry, under PEPFAR, PEPFAR had a lot more problems under Bush than it does now. And so I think people are still a little bit afraid of retaliation. But I think I would also. I think one method that I didn't use as much as I should have is trying to go through somebody that I knew to get an interview, being like, this is my friend. And I think that helps just to build automatic trust. If you're referred by somebody else, instead of just a cold interview, the wall kind of goes down a little bit. So I don't know, but it was so hard, and I never really did find the perfect answer to it.
Right. My other question has to do with PEPFAR, I was wondering if when it was reapproved for 2009 through 2013, I think it was, is the stuff which sort of seems like the Bush era obsessions with abstinence and the monogamous partner stuff, is that already written into the next 4-year, 5-year plan, or is that something that can be taken out or have funding directed to other priorities?
Yeah, my understanding, I think that in the original PEPFAR bill, there was a percentage that had to go to abstinence and partner reduction, and that couldn't include condoms, and that couldn't, you know what I mean? That it was a specific part that was written in kind of to appease a certain political group in the U.S. In the reauthorization, now they say that they should concentrate resources on it, but they don't give a specific percentage. It seems more almost advisory, and so I think people are really excited about that. Certain provisions, like you have to sign a document that says I do not support prostitution, that has remained in the reauthorization. So there are some things that are still problematic, but then a lot of things have improved though, and I think people have started to realize like you can't have a one-size-fits-all abstinence, partner reduction, monogamy strategy for every country. You need to look at each country, and so I think it's encouraging that the reauthorization did that.
Yeah, I guess my follow-up was sort of about the IRB. Did you have to go through the process through Emory and through the Rwandan government? Because I know people have definitely had trouble sort of getting like the international part of like their IRB accepted. So I was just wondering how that worked out for you.
Well, luckily, because I was partnering with Project San Francisco, which is a really well-established organization in Rwanda, that was pretty much taken care of. They work with the Rwandan government. They also work with the Emory IRB. And so really all I had to do was I had to take the class online and then just send her my certificate. And the program took care of everything else. So if you can get that sort of situation, it's perfect. Now, I don't think this would have worked if I was doing, say I was doing this research on genocide survivors or something like that. I would have had to get my own IRB. But since I was doing, high government officials and high NGO officials and people who weren't very vulnerable, I could go through her IRB. Yeah.
Well, if you think that you're going to do something too that might need IRB approval, I really recommend for law students that you try to find a faculty member who's got a project going on in that area. So like Dan, you can get to become kind of a collaborator on their project instead of trying to start from scratch, because the IRB process is geared towards very detailed research design, and it's not necessarily the training that we have as JD types to be able to do that. So if you have that training from your background, you might be able to start from scratch with that. But for most of us in this type of environment, it's going to be much easier to hook up with people who are already doing that and try to kind of ride on with their IRB approval. So that's one recommendation around that. Any other questions or comments for Dan?
Well, one thing I would add to that too is the public health school is a great resource if you are looking for people who know about IRB, because they deal with it all the time. So if you're looking outside the law school, it's a great place to go.
All right. Well, thank you all for coming today.
Thanks, guys.